So good afternoon, everybody. My name is Carrie Schreier. I'm an extension educator with our children and youth programs at Michigan State University Extension. And I'm excited today to welcome two guests to our MVP webinar to talk about how we can gather safely for the holidays, both those complicated medical questions we might have, but then also how to do this. Like, how do we communicate about it? How do we talk about it? How do we navigate those tricky relationships, which for many of us have just gotten trickier over the last couple of years as we haven't been gathering as regularly. So with that, I'm going to go ahead and hand it over to Katie to introduce herself, and then John, and we'll get going.
Hi, my name is Katie Stanulis. I'm a family nurse practitioner. My practice is in East Lansing. I've been working in this role about 7 years, and I got 9 years of nursing experience before that, and I'm really excited to be a part of this conversation today. So thanks for having me.
And I am John Novello. I'm a clinical social worker. I've been practicing for about 25 or so years. I've been at MSU in the Employee Assistance Program and the Health for You program as a counselor and a health coordinator educator for about 17 years. I'm currently acting as the interim director of the EAP and of Health for You. And I'm also really excited to be here. I love doing these little panels and discussions with for all you out there in Extension world. So thank you.
Well, great. Thank you both so much for taking time this Friday afternoon. I know with Thanksgiving now less than 2 weeks away, this is a topic lurking on everybody's mind. We were just finalizing our family plans the last couple of days. So we're going to jump right in. And our first question is one that is a big one. So our first question is it okay to ask family members or friends if they're vaccinated? And if so, how do we do that politely?
Well, the simple answer is yes. It is okay. It is okay to ask folks and family members and friends and the people you're connecting with over the holidays if they're vaccinated. The challenge is if people have big feelings about that one way or the other, sometimes we end up in what feels like very intense or tense or conflictual conversations with people that sometimes we have a tendency to want to avoid. And then when we avoid those things, we don't end up having the conversation. And when we don't have the conversation, we end up finding ourselves in a position where we might be reacting to something that we don't want to happen. And in that reactive place, we're more likely to be sort of like maybe not our best self. So what I always tell folks and what I try to do myself, like, I think the best thing to start with is, and I'll say this probably 30 times today, is really you want to start from you yourself getting some clarity and actually thinking about what you are okay with and what you're not okay with before you even get to the place where you're going somewhere where you're going to be showing up. And to really get clarity about like that, to think about, are you going to be comfortable being around people that are not vaccinated? Is that okay with you? How many people? What kind of space does that look like? Right. And to actually think through that beforehand. And then the most important thing is to have a conversation. And when you have the conversation, really the goal of the conversation isn't to try to convince other people or talk them into being like you or thinking like you. The goal is simply to state where you're at and to be clear about that so that you can get more information about where other people are going to be at too, right? The impulse often when we feel like this is to try to bring people our way because it's uncomfortable to be in that position of conflict. But if you're working with somebody that a family member or somebody, Uncle Bob, you know that they're on the other side of this discussion than you are, they're probably not changing. Most people are probably pretty dyed in the wool about this already. So the goal can't be to try to convince them. That just puts you in a position of conflict, and then that becomes frustrating. So the goal is instead to get information and to make sure that people around you have enough information about you so that you can all make good choices about what makes the most sense. You get to decide that maybe sometimes if somebody really doesn't want to be vaccinated, they don't have to be vaccinated. Right. But the language here becomes really important because when you have that clarity, you can come at it from a position of empathy and curiosity, right? Staying in that curious place about other people's experience, while also that helps you remain out of judgment of them. The point is giving information and getting information. You're getting data. That's all it is. And if you can reframe it that way and stay out of this kind of battle, then it can sound more like, so we've really been thinking about this in our family, and because of this reason and this reason, or whatever your reasons are, we really still feel strongly at this point that we're just not comfortably being in close quarters with people who aren't vaccinated yet. So I thought we could just have a conversation about that. And it's fine. I'm not trying to convince you. This is an important part too. You're not trying to convince them to get vaccinated. You're saying, I would really love to see everyone, and this is where we're at. So that's a starting point to the conversation, right? So I think that's probably the most helpful way to think about it. So you stay out of the battle. You don't need to be push-pulling with people about this. Really, it's just about getting some data and giving them some data.
Right. That's a great way to approach a lot of these issues beyond vaccination. Katie, do you have anything you'd like to add to that?
No, I just reiterate what John said. I just think it's really important to remember that we have a choice, right? So, I think it's great. Start conversations early to avoid conflict at time of big events, 100%.
Yeah, the more prepared we can be walking into these spaces, the better off we all are, right? We say that in parenting world too. Tell your kids what's going to happen, walk them through everything. So same sort of concept, but from the adult lens.
Exactly.
Great. So our next question, and before I jump into my next question, I do want to remind everybody watching along that you're welcome to share your questions in the Q&A, or if you're on Facebook, you're welcome to share your questions there on our Facebook Live feed as well. So our next question is that last year, before people started gathering, we saw recommendations that people should test before they got together. We saw families perhaps not sending their kids to school the week before a holiday so that they didn't have exposure and get quarantined. Where are we right now on those recommendations to test? And is it just COVID we should be testing for? Are there other things we should be thinking about?
Sure. So excellent question. You're right. Last year and probably the year before, there was a lot more push to make sure people were testing before gathering. And I still think that's just a general good rule of thumb to protect yourself and others. I think everyone has a different comfort level on how often to test and when to test and before what events. So certainly testing for COVID-19, the number of locations and ways that we have available to test for that is just increased dramatically and really is accessible to anybody. I had put, if somebody would drop that link to there's a great link on the michigan.gov website where for all Michiganders, where you can kind of click all the options, like put in your zip code and it'll take you to all the options in your area. So, we still have the ability to, I believe, get free testing through the federal government and they ship it right to you. Those are the rapid tests. Rapid tests are readily available at pretty much any local pharmacy. Costco sells an awesome giant pack if anybody's into bulk buying like I am. And then certainly there's still the PCR testing available, and that's typically done at more of a medical setting, whether that be an urgent care or any of the drive-through lab sites. I believe some pharmacies offer that as well. Those tend to take a little bit longer to get results back. So planning ahead for that, maybe a day or two. The rapid tests typically, depending on, they're about 10 or 15 minutes. And then as far as testing for other things, so we're hearing, it's predicted to be a pretty nasty flu season. And also we have the RSV rates are on the rise among children. And so testing for those, we don't have rapid tests that are readily available to the public just over the counter at this point. So that would definitely, you have to have some sort of healthcare contact point for that. And typically with a provider's order. So that would mean connecting with your provider, either in person over telehealth to get an order for a drive-through lab, let's say, or being seen at an urgent care walk-in clinic, that sort of thing. So as far as should you test, if you're having any symptoms that could be, any sort of acute viral upper respiratory illness, I think it's a great idea to protect you and your, more importantly, your loved ones.
Great. Do you have anything that you'd like to share or add on to that, John?
No, that's a great answer. I wrote a couple things down earlier. I was looking at these. I
went ahead
Katie.
and added that link in the chat. And the other, if you're like me and have a big family and have already used up your federal testing allocations, the state of Michigan is also now doing some free shipment of tests to your home. And mine actually, they're shipping through Amazon and mine came next day. So it was very handy because then I had a child who was sick. So. All right. So our next question is one that I already touched on a little bit, but I do want to go ahead and ask it because it is a little bit different than our first question. So we all have our family and friends that have their opinions with vaccines. And at this point, we all probably know what they are. What would you suggest is the proper way to handle those difficult conversations with your family and friends over issues like vaccines and COVID? And I suppose in many cases, this actually stretches to other things you might
other things too. Yeah,
Mm-hmm.
that's really true. Politics, all kinds of fun stuff going on. Yes, that is a great question. And it is a little bit different. It has some same elements in terms of how I would encourage people to think about it. But but it's a little bit different because you're actually having a conversation about those hard conversations, and what so I'll say this a lot. Start with your own clarity. Like, you can anticipate the kinds of folks that are going to be the ones that you're more likely to have these conversations with. And it would be helpful if you just spend some time thinking about like where you are with this stuff. What do you think? What do you believe? Why do these things matter to you? Like, reflecting on that. And without that clarity, again, like I said before, you're going to more likely hang out in a reactive place, or you'll find yourself disappointed. Like, we sometimes go to Christmas or holiday events and we have like a hope, like this year it's going to be different, and hopefully nobody will be right. And then right, like that's a setup for yourself. Like it denies the reality of the people and the truth of who they are. They get to be that way. You get to be the way you are. They get to be the way they are. That's all the way that it is, right? So then that sets up a different disappointment when you have to sit with that hope. So we want to sort of accept the reality of it and sit in that. I would also suggest that you can think about what it is that you actually want for yourself and for your family, for your immediate family, or whatever, like the parts that you can control. What do you want for your holiday experience? What's the feeling that you'd like to cultivate? That's something we don't think about a lot. And it's a really important thing to think about. If your goal, for example, your primary goal, for example, is to have like relaxation, then you might decide that you don't want to have these kinds of conversations. You don't have to engage in these, right? So if your goal for the holiday experience is to kind of like just show up, be with people that you care about, have a pretty chill vibe, like, you get to do that. And if people engage with you, you can say, I'm having a really nice time with my little eggnog and watching the kids play, and I got my cookie, right? And I kind of want to stay in this feeling. So I would like to just back out of this conversation, and you get to do that. So first of all, I would just say that that's important. Sit with what you need, with what's important to you and who you are in this moment. If you then are someone that's more like open to this kind of discussion, or if you find yourself in it anyway, sometimes it just happens and you're just in the middle of it somehow, also reflect on what the goal of the conversation is. Is the goal of the conversation to convince, or is the goal of the conversation to explain your position and be curious about somebody else's position? The more that we are in a place where you are feeling like you have to convince, if you're talking to somebody that's not convincible, right, and they're just having the conversation to argue, and you're having the conversation to argue, then that more likely is going to stay contentious and not go unless both people are like in the agreement that we are in a debate kind of thing, and then there's a respectful kind of thing that happens with that. But short of that, the way that these sometimes get contentious is that not everybody's sort of in that same space. So if you kind of walk into that with the understanding that the goal of it is not necessarily to convince somebody to believe what you believe about vaccines or Joe Biden or whatever, right? Then it can just be about discussion, right? And so you want to be able to state your part clearly and say it, distinctly, and then create some space to hear them and try to be curious from their point of view. Try to remember, you don't have to convince them, but just kind of wonder, I wonder why this person who I really care about believes things really differently than me, right? And then if you can sit in that space, it might feel less contentious and it might feel less yucky. So again, that's the thing I would say, like, it's not about convincing. If you can stay out of that, it's more easy to stay in a position of curiosity. That's probably my favorite thing I'd like to say anyway, kind of in life. Like, if you can stay in curiosity, it's easier to just navigate around conflict and difficult things that when people don't agree with you.
That's fabulous advice. I like that. Stay in a position of curiosity. Mm-hmm. Katie, do you have anything that you would like to add about that whole, how do we talk to our friends and families about vaccines?
No, super well said. Very well said, John. Thanks.
Yeah. This is, I think at this point in time, we generally speaking have a pretty good idea where our family lies. And yes. I think you're very right. Thinking about where you want this to be when you walk in the door and how you're going to approach this, and being in that position of curiosity is great.
Yeah. When we were talking about this for the folks at online, we were talking about this the other day, us here in this chat thing. Katie said, there really aren't going to be any surprises as to who's what. And I was like, man, that's a really great point. So, so that's a helpful thing to remember.
Yep. I think for many of us, though, I heard one of the things you say was, wishing things were going to be different. And I think for many of us, we're gathering again in these spaces for the first time in a couple of years. And so these are important reminders that, what has changed and what hasn't changed over the course of the last couple of years. So, yeah.
Absolutely. Right.
Great. So our next question is about symptoms, and how do we go about communicating to family members if they have any symptoms they shouldn't be attending or you don't want them attending? And I know as a parent, I struggle with this idea of symptoms. What is a symptom? Like, when can I send my kids to school? When can I not send them to school? Is it allergies? Like, why are we coughing? It's symptoms are a difficult word right now. So how do we go about having these conversations with our friends and families about their symptoms and what we're comfortable with them attending a gathering with?
I think that would be a great helpful thing to also have Kate talk about, like how to define symptoms. I think that's I really appreciate you said that, Carrie.
Yeah.
From the family communication, my side of things, it's tricky because you actually can't tell somebody what to do, right? So you can. It doesn't often go well, right? If somebody's showing up because they have symptoms, if somebody's showing up to an event or you're going to somebody's house and they have symptoms, or you're aware that they do ahead of time, like there's lots of reasons that they might be ignoring that. They might not want to, psychological reasons or familiar obligation reasons or worries about like disappointing people. There's lots of reasons that people fall into that, and so what's tricky is because you can't really tell somebody what to do. It's like, again, the communication part is probably the most important part. And it's helpful, again, to get ahead of this before you're having to react to it in the moment. Showing up, having had the conversation, and you're going to your parents' house or whatever, and you show up, right? Or you hear about somebody who's got symptoms and you're aware that that you've got this thing tomorrow, and say your brother or whatever is like saying, telling you that he's got a stuffy nose and a sore throat and maybe a little fever, but it's probably allergies, right? And you're going to, grandma and grandpa's house tomorrow, and somebody's got COPD, and you're kind of worried about that, right? And then let's add to this a little bit. Let's say grandma and grandpa don't want to rock the boat, and they're like, no, I'm sure it's fine. It's going to be okay. I'm sure it's allergies. Let's have them come over. And you're the one worried about it, right? But everybody else is being cool with that, right? It's hard because people get to make their own choices about this. So if you talk about it ahead of time and sort of set it up before you get to that place, right? You can sort of then set up to say, hey, so can we all, I'm uncomfortable going to the places when people are having symptoms. So as a group, can we agree that it's okay that if somebody's having symptoms, we'll just decide and let people know where we're at, and then everybody has full information, and then they can decide what they're comfortable with and not. So you're setting up, almost creating like a culture of expectation, a culture of open discussion about this. But it doesn't happen unless we dialogue about it ahead of time, because not everybody's thinking the same way necessarily. We can't guarantee that everybody's thinking the same way as you.
Katie, could you talk a little bit about that symptoms piece and what is a symptom? What should we worry about these days?
Yeah, absolutely. So I think we've been I'll speak personally in the medical profession to some degree, even here in my own office, have been desensitized to the word symptoms, right? So I'll give an example. I work at a family practice, so outpatient, we do telehealth as well, but we are having people come physically into the office on a very regular basis. And our policy right now is that we are not seeing people who are acutely ill with symptoms that could be COVID without a negative COVID test within 24 hours. And that's in order to protect, our vulnerable patients, our elderly, our immunocompromised staff, right? Or patients, but also our staff. So at the front desk, a conversation I often hear when I'm buzzing by is at check-in, my reception person will say, do you have any symptoms of COVID? And the patients say, no. And then, they wait in the waiting room. The MA brings them back. They go through the thing. And then I come into the room and they're like, well, I'm not feeling very well, right? Like, I've had this runny nose. I've got these body aches. My throat's a little scratchy. I've got this dry cough, and sometimes I'll even ask them, I said, did the front desk ask you if you had any symptoms of COVID? Well, yeah, they asked me that. And, so there's this breakdown, right? So I think that when we talk about symptoms, it's really easy to just say that, but we've been desensitized. So let's be specific, right? Hey, have you had a fever? When we're having these conversations ahead of time, hopefully, like John has mentioned, are you having a fever? Are you having any cough, any sore throat? Are you having any signs of an acute upper respiratory illness? So I think just really making sure the language is clear, and then asking directly about, specific, maybe listing a few symptoms, right? So yeah, because there's a whole, we have this whole, there's a lot of overlap, right, of different upper respiratory illnesses that they have a lot of similar symptoms. So I think, and part of my job as a medical provider is to like elicit those, right? What do you have? What don't you have, to try to narrow it down? But yeah, so maybe using just a little bit more specific language, like, how are you? Can we get back to just like checking everyone's temperature before they come into the family gathering too? No, I'm kidding. I don't really think that helped that much. So.
No, I really like that though, that, instead of just using the word symptoms, saying like, have you been coughing? Have you run a fever? Really being explicit about what we mean. Because yeah, I think you're right. I think we have become very desensitized. I think about that question, I went to get a blood draw. Have you had any symptoms of COVID? You're not taking a lot of time to stop and really think about it. And perhaps you're quite confident it isn't COVID. So you're not taking the time to explore that. Great. Well, so we're going to take this a little bit of a step further. So now we're already at our gathering. We're already there. And you've got, Katie showing up with her friend who has symptoms, right? Katie brought a guest who has symptoms and appears to be sick. What do we do when we're already in that gathering and now you have somebody walking in the door who is by all accounts ill? How do we handle that?
Yeah, that's hard. So it's hard if somebody's bringing a guest too, because it's not maybe somebody that we don't know. So again, at the risk of being super repetitive, this will go much better if you've already had the conversation, like every time, because minimally the person who brought the guest will at least have heard this, right? And they might be uncomfortable. There's the possibility that there's some belligerent sort of like defiance there too. But more often than not, what happens is when people have symptoms, they do this thing where we sort of like ignore the thing that makes us uncomfortable. And we don't really want to believe it's true because we don't want to have to say no, or we don't want to have to embarrass ourselves, or we don't want to have to like not go to a thing that we really want to go to. So we tend to sort of overlook that stuff. And so the person that's bringing the person more often than not is probably innocently just avoiding, right? And there is some discomfort that comes in there. So if you've had the conversation already, it's always helpful to, to pull the person aside who's the person that right? Not the guest, but the other person, and start there. And say, hey, so, we talked about this and I'm noticing that this person's hacking up a lot and, blah, blah, blah. And I have to, and then state what you're feeling about it, right? So just by saying this person's having these symptoms that I see, and I think I would say what Katie said is helpful here too, be specific, right? They look sick is subjective, right? It's allergies, but they are coughing and they're wheezing and they're sneezing on people and they're using a lot of Kleenex, and like the specifics of that would be helpful. And then to say how you feel, like, I feel uncomfortable with this. And we already had a conversation about this a couple of weeks ago. And do you remember I said that I wasn't comfortable with this? I wonder what you think about that. And so you're sort of inviting a conversation, but you're saying what you're noticing, just describing what you're seeing. And then you just say clearly where you're at with it, right? You can't make that person take the guest away, right? And I think probably depending on the social circumstances, probably going to everybody else in the party to sort of like put peer pressure on them is probably also usually not cool. It doesn't really work well. But to have a direct conversation with the person that you're uncomfortable with, to have that dialogue, and then to see what happens, right? They may go, I know, I feel bad. Like, and then that might open up a way to say, so I'm not sure that makes a lot of sense to me. And, and if they decide that they can leave or they can put a mask on or whatever we're comfortable with, whatever you've decided ahead of time, there may be some like details about that would be helpful. Then you can maybe get to that place. If they say, nope, I'm not talking about it, and there's some sort of like they're just holding the line, you then get to decide what you want to do, and you don't have to stay, right? Now that's uncomfortable, and there's disappointment with that, and there's frustration. So you're still going to have feelings about it. This doesn't take those feelings away. You might even be angry, right? But it doesn't come with that hostility or that defensiveness or attacking kind of thing. It is a fact of the circumstance, right? This is the situation as it is right now. This person has brought this person, and if they're unwilling to leave, then you get to decide what's right for you and what's right for your family. Remembering that people do get to choose. They get to decide what they want to do in a situation, even when it's inconvenient to us, and even if it makes it feel really uncomfortable. So again, starting from that position of curiosity and openness, but direct conversation rather than talking behind their back, trying to, talk crap about them or something like that over here and be irritated or just like shoot dirty looks at them, that's not helpful. It doesn't send the message you think it's sending, right? It's a message that you think is really clear often, but it isn't necessarily really clear. So the direct way to do it is always better. It avoids problems later, right? And even though it's hard, it's quicker. And then you get to decide what you want to do.
I have this mental image of everyone at the gathering giving dirty looks to Katie's guest who came. No one's saying anything because that happens, right?
Totally happens all the time.
Yep. We're all given that, and then we're making eye contact with each other and thinking about the conversation we had in advance. And
the thing you hear all the time when people have situations like this is when they talk about it later, you hear frequently, well, I was super irritated, and I'm sure they could tell because I was doing this thing. And they probably could tell that you were irritated. They may not be able to piece it together what you were irritated about. That's the thing. That's where the communication is important, because you're looking irritated. They could interpret that 1,000 different ways. They could just think you're mean, or you're in a bad mood, or, why should I talk to this person, or whatever. They get to sort of like, again, if they're already ignoring the symptom, if they're already doing that, then they might also not be piecing together that this is related to that. And that seems really crazy sometimes. It seems really obvious, but it's actually not, right? So it's important not to necessarily assume that people know where you're at. That's why communication is so important. When we don't communicate, people will, here's a good therapy thing. In the absence of information, I usually use a different word here, but this is public. So in the absence of information, people make stuff up. And usually they make that stuff up from the lens of their mood or their attitude, right? So if your mood is like annoyed, then what you're making up, the thoughts you're making up about that stuff, because you only have the data that you have is that the person looks irritated, right? If you don't have any other data about why they're irritated, they haven't said anything to you, you're going to invent that out of your feeling state, right?
Right.
And that isn't always accurate. So communication, always helpful. Not always easy. Don't want to say that, but it's always helps.
Yeah, people plug in that whatever that might be. They're upset Katie brought a guest, or they think they didn't have permission to bring someone, or right. They're plugging in all this other information that for you maybe isn't what you intended. Are there cases, Katie, where somebody might be symptomatic with something that would be appropriate to attend? I mean, if somebody is coughing or sneezing and maybe they really don't have COVID, is it reasonable to attend?
Sure. Hopefully they've at least done a rapid COVID test, right? To be abundantly sure that they're not contagious with COVID. But like I mentioned earlier, there's a lot of symptom overlap, right? With other respiratory illnesses or allergy type symptoms, or, people who have chronic rhinitis or other chronic breathing problems, right? So I think kind of a good rule of thumb is thinking about, if that person or if you're the one that's not feeling well or without a fever, if your symptoms aren't getting worse, they're getting better. And then just taking good safety precautions, like the good hand washing, social distancing. We've talked about all this, so many times, or maybe that if the event's really important to that person or if you're the one that's having some sort of active symptoms, is just choosing to mask, right? And I think just because the mask mandates aren't happening outside of medical facilities currently doesn't mean that it's not okay to still do that, right? And honestly, as a personal choice, I'm not really sure I'll go through another cold and flu season, especially at work, without masking. I think back now to 3, 4, or 5 years ago when I'd be seeing people come in sick, like acute influenza, and I'm just in the room with them, breathing in their space, and I wash my hands, but I don't think I'll do that again.
It is funny how much that's changed our frame of reference, right? I think back to the before times and that idea that we could go to work sick or send our kids to school sick or to daycare sick, or, that we would be sitting with our providers without masks, visibly ill. And in retrospect, that does seem really wild that we thought, sure, it's fine to go to school sick or whatever it might be. Yeah. As a former teacher, I definitely appreciate the stronger awareness of the things that we may be bringing into the spaces that we're in. Right. And this is such a tricky subject too, because you don't want to be prying into people's medical history, right? You don't want to be sitting down saying, okay, do you have asthma, COPD, chronic da, 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 da. Is this why you're coughing? Or could it be something else? So, I appreciate the tips on how to kind of navigate some of these conversations.
Yeah. And
So,
I think,
go
okay,
ahead.
I just want to add one more thing about how to maybe some almost scripting to use if you do have that person, that comes and maybe is symptomatic. Just from my personal life experience, I find that if you own the observation. So like, hey, I noticed that you have quite a cough, and you just have this look about you that aren't feeling well. I'm concerned about you, what's going on with you, instead of just saying like, well, there you have symptoms and you need to go, right? Like it really kind of like softens the approach if you're owning the observations, and I think definitely lends more to like having a conversation versus an argument about it.
And just to add a slight bit to that, to also own your feeling about it.
Yes.
You can't speak for anyone else in the room and to know whether or not they're comfortable with this or not. That's not often helpful, because if they go and then talk to somebody else, or somebody else looked like they were fine with it, then your words then become, and we sometimes do that. We over sort of assume to like make our argument feel bigger, or we blame somebody else, so we take ourselves out of it. And so well, it's not me. It's like Uncle Bob over there. He's really uncomfortable with us. I talked to him the other day, right? That own your part. If you're the one having the conversation and you're the one that's uncomfortable, own that too. Express your discomfort. That's okay. And a good, strong relationship should, even a kind of not strong relationship, can usually tolerate that if you're being direct and it's coming from like a heartfelt place and you're having compassion for them rather than judgment. But yeah, I really appreciate that, Katie, owning the part. Yeah.
Yeah, those I messages, right? They really important in communication, beginning with your observations and what you can see in fact, and starting with I, not you, can be very helpful and go a long way. So over the course of the last couple of years, we've seen the recommendations about COVID quarantines change, and I'm not even sure entirely where they are right now. So our next question speaks to that. So how long is somebody considered contagious at this point after they've had COVID? If you've been exposed to COVID the week before, can you still go to Thanksgiving? How do we know what we're doing right now in terms of COVID quarantines?
Yeah, so I agree, Carrie. There have been a lot of changes. And even as a healthcare provider, I feel like I'm, often being like, okay, I need to check in with CDC again. Like, where are we at now? And it was one way if you'd been vaccinated, and a different recommendation if you hadn't. And I'm happy to say it is more streamlined now, right? So that's good for me as a medical provider to be able to like relay the same message to people. So the standard is right now. So if you, whatever day you're symptomatic, doesn't matter, that's your day 0. So whatever the first day your symptoms are, and then it's recommended currently that ideally we'd want you to test right away, right? On that first day of symptoms. Doesn't always happen. So it's not so much based on the test date, but those day of symptoms is day 0. And then we recommend that you quarantine or isolate at home for 5 days. So 1, 2, 3, 4, 5 days after your day 0. And then after that 5-day period, as long as your symptoms are improving and you've been without a fever, without medications that lower fever, like ibuprofen or acetaminophen, for at least 24 hours, then you can end your isolation or quarantine. But then you should be strictly masked with like a high quality mask in any public setting for an additional 5 days. So that's kind of like the blanket for 98% of the situation. And then as far as exposure, it's recommended that you self-monitor for symptoms of COVID really closely for at least 10 days after exposure. It is recommended that you should test 5 days after exposure and or anytime symptoms develop. And then if somebody could drop in, there's an awesome link to the CDC website. They actually have a isolation and exposure calculator that I actually kind of played around with the other day, because it can get really confusing, but it really breaks it down in really plain terms. Like, this is the day I was exposed, right? Or this is the day that I started feeling sick. This is the day that I tested. And it gives you like through, the 15th. Or so I found that was really kind of great that anybody can access that, right? So to look back, exceptions to that rule, as far as like the 5 and 5 that I mentioned for acute COVID, quarantine and isolation and masking, sometimes for people who have really moderate to severe illness, like maybe need to be hospitalized, they do recommend isolation for 10 days. And those that are immunocompromised, additionally isolate for 10 days.
Okay, great. That's nice that there's a calculator. And I actually played around with that too when my family had COVID, and trying to figure out who was at day what and when started where. And of course, all 6 of my family got it at the same time. So we were trying to figure out who could be around who, when, and where, and how, and why, right? So
Yeah.
it gets complicated, especially when my kids just skip through it and we're hardly sick. And yeah, it's different for everybody. Great. Well, thank you. I did drop that link in the chat there. So our next question is going to shift a little bit to talk about RSV. And I know I've heard that, in fact, I just heard yesterday that Mott Children's Hospital is at capacity in the children's floor due to high rates of RSV. So our next question is about babies and RSV. I have a new baby and I'm really worried about RSV. Is it reasonable to ask if my family members don't come if they're sick or get tested for RSV? I'm trying to make that protective space. My family tells me that I'm being overprotective, but I already know family members and people who've had their babies hospitalized for RSV, and I'm really concerned about this. So how worried should this mom be? Is there anything that she can do to help reduce that exposure?
Sure. I'll speak to that medically first, and then we'll let John jump in on the conversation piece of it. So RSV is respiratory syncytial virus. It's a really common upper respiratory illness that we typically see seasonally in the fall and early winter months in this part of the world. And it's been the last 2-3 seasons have been different than we're used to. In 2020, because of lockdowns and isolation and masking and such, there really was like an almost non-existent RSV season, and then it started making its way back. And this year it actually started pretty early or late. We're not quite sure yet, but it's hitting kids pretty hard. And it typically is a mild to moderate illness that runs its course fairly quickly. But infants tend to be at higher risk just because their immune system and their lungs are not as mature as older children and adults, and they haven't been exposed to it before, so they don't have antibodies, and it can cause wheezing and difficulty breathing. And some, especially younger children, need to be admitted to the hospital and have supplemental oxygen or additional breathing treatments and that kind of stuff. So it is kind of scary. And yeah, cases are significantly on the rise in Michigan. I know a lot of local pediatric hospitals and emergency rooms have kind of been on the lookout because their numbers, they're busy. There's expect longer wait times, that sort of a thing. So RSV again kind of fits into that similar clinical picture of a lot of upper respiratory illnesses. So it's not always easy to differentiate between COVID or flu or RSV, but cough, wheeze, fever are kind of the hallmarks of that illness.
So how does this mom, John, tell her family that she's really worried about this and that it's a real risk, and she's not just being, that paranoid first-time mom or whatever it might be?
Let's just sit with that word, right? So first of all, is it reasonable? Yes, it is reasonable. It is your baby. It's your baby, right? And you get to decide what level of protection, what level of risk you're okay with and what you're not okay with. You absolutely get that decision. Grandma doesn't get it, grandpa doesn't get it, Uncle Bob doesn't get it. No matter what somebody else tells you, right? That's not their kid. It's your baby, and you get to decide that, right? And it's absolutely okay. Now that word, overprotective, right? That is a complicated word. That's usually a word that's intended, whether because of ill will or just because they want to see the baby, right? That often has the effect of shaming people, right? So that you break down what you feel bad about it, like then you doubt yourself, right? And then you go and you make a different decision than you're comfortable with, right? So that's complicated, and it's a word that gets applied to mothers often, right? In a way to sort of shame them and make them feel like what they're feeling is not okay. But it's your baby, and this is serious. I mean, listening to what Katie said about RSV, like this is a real deal. This isn't a small little thing, right? You get to feel uncomfortable with that, and you get to decide, which means you also get to say, I'm not comfortable with people holding my baby. I'm not comfortable with people coming over if they're sick. Are you getting tested? Are your kids getting tested? You get to say that. So the same kind of thing, I think, that we talked about before, being direct and clear about it ahead of time, having people when they come over, having an expectation when they walk in your door, right? What your expectation about that is. It's really okay And if they try to use the overprotective thing, like, own it. Rather than feel like you have to get in an argument with them saying, yeah, maybe I might be being overprotective, but that's where I'm at, right? And that's just comfortable. And that's okay. And that kind of often diffuses the conversation, because what the other response is to get defensive and start to, well, I read this thing and then you're engaging in argument, which then they can counter, and you're in this back and forth thing. That doesn't matter. This isn't a good friend years ago when he came to pick up his daughter from our house when our kids were toddlers, walked in the house and she started arguing with him. And he said, I have to tell you, sweetie, you're mistaking this conversation as a negotiation, and it's really not. And I thought that was a great line. And it's not a negotiation. It's your baby. You get to decide, right? Now, there is an interesting conversation to have individually with yourself, like to wonder, like sometimes people that struggle with maybe anxiety disorders, right? We may overestimate threat often, right? As a way to sort of protect ourselves from any negative thing happening. And anxiety does sort of lend itself to that. And so if you already struggle with anxiety and you are wondering about the facts and whether or not, because what anxiety often does is sort of like have us believe that the threats are more than they are. So it's not always a bad idea to suddenly go, okay, that doesn't mean you doubt yourself. It means you start from the position of like, then I guess I have to understand what the facts are here. What is the evidence that I have? What's the thing? And what's going to help me make actual decisions about this? We don't want it to be because I feel uncomfortable. But listening to what Katie said, if I had a baby right now, I would do the same thing. I probably wouldn't be comfortable letting just random people hold my kid, right? So, I have a 17-year-old and a 20-year-old and a 23-year-old. So they're way past that at this point. But but the point is that, like, aside from, so if you have an anxiety thing already, or you wonder about that, just get some facts, like dig into it a little bit. It still doesn't mean you're being overprotective, right? It just means you might need some more data. But more than that, if you're feeling that you don't want to do that, don't do it. You get to decide that. You're the parent. And it's a baby, they don't have all that. They can't do it for themselves.
Yeah, great tips on both sides there. I know RSV certainly is very present. And I remember worrying about it when I was a mom, pre-COVID, pre all of this. I still am a mom, I guess, but my kids are 10 to 19 now. So my worries about their exposure are different at this point. Great. Well, thank you. So we just had a question come in the chat from a participant. And the question here is, how would you handle the situation of parents, one whole side of the family, being against it, disagreeing on whether or not to have children or a child vaccinated against COVID-19?
Yeah. So again, it's so hard. I mean, right, because there's so much expectation and pressure and feeling, that comes around holiday gathering, the sense of both expectation and obligation on one side of things, but also like the excitement and the enjoyment and the thing I don't want to miss out, and I don't want to miss this thing, and I don't want to be the one that's not included, right? This is a really hard situation, but it's kind of like what we were talking about before, right? Is that the people who don't agree with you, whether you're on the side of, and I think this is important, whether you're on the side of like being like wanting to vaccinate your kids, or you're on the side of like thinking it's not a big deal. You get to decide that it's your thing, whatever. But I mean, this question is asking, like, what do I do with my family members who are against this? So they get to be, right? It's uncomfortable. You can think of a million reasons why. You could argue with them and tell them that they should, that you're worried about your nieces and nephews, like all that stuff. And it all might be true. And you can express that stuff, but it may not mean anything to them because they've already decided this, right? So if they're not in the position of wanting to actually be curious with you and being open to learning something different and wanting to kind of come your way, then having an argument isn't usually useful. So instead, we want to wonder again what the purpose of the conversation is and what you're okay with and what you're not, right? And if you're not okay with something and those people are coming, and say the hosts of the event are also either okay with not vaccinating kids, let's just using this direction, they're okay with not vaccinating kids, or the kind of like the example I gave before where they might still prefer it, but they're not wanting to rock the boat because they might be prioritizing unity, or that's not quite right. They're probably prioritizing lack of conflict is probably what they're actually prioritizing, which is fine. They get to do that. And you also get to prioritize something different. You can prioritize wanting to be as safe as you can be. And that's okay. So, but it has to start from where you're at. And it also has to, there is a piece that's like, you may have to decide that there's things you're not going to do this year, right? And that's hard, right? And there might be grief around that. There might be frustration around that, and that's understandable. But that's also that's where your choice comes in. That's where your actual power or your agency is that even if you have a whole side of the family that's disagreeing on what to do, right? Chances are you're not going to be able to talk them into it, or most of them, or enough of them that it's going to make a big difference. So you might have to make hard decisions about that. Now, again, you can prioritize different things too. It's important to have the conversation to see if there's any room for at least, sort of having some room for accommodations or coming to some kind of compromise. But at some point in that conversation, you'll learn, pretty quickly whether there's room for compromise. And if there isn't, then you just get to make a decision about that. But it does start ahead of time, right? Waiting until the moment that you're at the door and then hoping, I hope they all did it right this time. You're walking in the door and then being face to face with the fact that maybe that's not happening, right? That's a pretty late in the game sort of thing. And you're having to react to the problem. And if you haven't thought that through, then you might feel uncomfortable and should we stay? I don't want to like rock, and it becomes weird. And then you might stay longer than you're comfortable with, and you're not lining up with your own integrity or your own choices. And that gets tricky. So you can think about it ahead of time, think about what you're okay with and what you're not, what your compromises might be, by the way. If you have some, sign that and talk with your partner, your spouse, your kids, your adult kids, like whoever your group is, right? Have that conversation about where your line is, right? And then put it out there and see what happens. And if it doesn't go your way, then that's the fact. Then that's the point of the conversation, is you're getting data. And then you get to decide what you do with that data, which might lend itself to feeling bummed out. Or maybe it's good. Maybe, you have this nice conversation. But that's what I would say. It has to be a hard conversation. And it probably is, the earlier you can do it, the better.
Any additional thoughts on that, Katie?
Yeah, I've certainly seen this situation played out, not just with COVID vaccines, but other vaccines in general every day in my practice. So since I'm in family practice, I see, newborns all the way up to my oldest patient right now, I think is 92. So I certainly have seen it come into play for years with that. Parents often disagree about, there's some vaccines that seem to be a little bit more of a hot topic than others. But yeah, so I think that, so my job as a medical provider, this is a conversation I have with my patients all the time, is that it's my job to educate, right? Like to educate you about what vaccines are available, how they work, why we recommend them, risk, benefit, side effects, right? That's my job. And ultimately, I always say you and your family are going to make, you're going to make the decision that's best for you. So I think having good quality, neutral information about whatever the vaccine is really important. Having a conversation with your medical provider about it, ask questions, like, please ask questions. That's what we're here for, right? And then when it comes down to kind of, and I'm not a legal expert, but legally, right, like that, the parent or guardian decides, right? Because it's a medical treatment for their child and they have to give verbal permission or consent for that. So, if we have two parents here and one saying yes and one saying no, in my personal practice, I wouldn't give the vaccine, right? That's too much conflict. And I think that creates, certainly that's conversation for if the parents are together, right? Like that's a conversation for that couple to have and decide, hash out outside of the office, ideally. But let's say like mom and dad
Sometimes
aren't
they come
together.
into my office to have that conversation.
Yeah, right? Exactly. But let's say the parents are not together, right? So if just one parent comes in with the child and they want the vaccine and they give that verbal consent, we're going to give it, which, may create some conflict on the back end. Certainly, I think it depends on how good they are at co-parenting, right? Ideally, that conversation has happened before, ahead of time, but doesn't always. I think there have been some cases in the news about divorced parents that, one took the other to court because the mom, for religious reasons, didn't want to get the kid vaccinated, but the dad did. And, I think probably more times than not, it's going to play out that the judge is going to side with like science and the health promotion, disease prevention side of the issue, right? So hopefully it doesn't come down to that, but
those are tricky and complicated issues.
Yeah.
Well, we only have, believe it or not, just about 8 minutes left to go. And so jump ahead with a couple of our questions that I want to get to. And we had a couple that really stood out as I was flipping through the questions. One of them is about, what are some of those practices that we can do when we're gathering together for those meals to help reduce the risk that we might be transmitting anything while we're there?
Yeah, so absolutely. As far as kind of like basic food safety stuff is anything we think of like in a restaurant or like a public buffet sort of setting. So good hand washing. People are either literally going to the sink to use hand, soap and water, or having hand sanitizers readily available, having serving utensils so people aren't kind of double dipping and contaminating that way, making sure not to reuse plates and cups, right? Just like we wouldn't at a public restaurant. They don't want us to bring our germs that are on our plates and cups back up to those community stations. And then certainly, just the general safety things, the social distancing, covering coughs and sneezes, using tissues, washing your hands after coughs and sneezes, that kind of stuff. And one of the things that we had kind of talked about the other day is like, what if, somebody isn't feeling great, they've tested negative for COVID, they don't have a fever, and maybe they come and they choose to mask, right? Like, that's okay. That's great, and help protect them, but other people. And maybe if that person who's not feeling so hot, instead of having them, slog through the line all shoulder to shoulder with everybody else, maybe like, hey, you know what? You just chill out. You tell me what you want, and I'm going to go, let me make your plate for you. Right. So there's lots of workarounds.
I thought those were such really helpful practical tips, right? Because we can't always, or we might choose to go ahead and stay at a gathering where there's somebody we haven't seen people in a while, or we want to get together, and we might make that choice to stay. So I appreciate that. Those thoughts of, making the plate for somebody, not having them go through line. What about windows? I've heard that if you're having those big gatherings, you could crack or should crack windows for extra ventilation, or maybe be outside. Although I know it's supposed to snow this weekend. We're shifting here, so we might not be outside in Michigan for these gatherings. Sorry, John, if you didn't know that.
Yeah, so certainly ventilation. So anytime we're bringing fresh air into a closed space, it's going to improve ventilation, and that just reduces viral particles overall, which is certainly going to be protective. So depending on the weather and everybody's comfort, a cracked window or a couple to create that kind of flow through there is certainly not harmful, could be helpful.
Well, I'm going to ask one last question, and this is kind of a big one, so we only have 5 minutes. So I'm going to ask one last question, and we'll have a quick response, and then I'll bounce it to people to wrap up. But what do we do in the end to make this whole holiday thing easier? We've found over the last couple of years, a lot of people maybe cut back on extended family gatherings, and maybe they found that was just easier, and now they're kind of dreading jumping back into this whole thing. What do we do to make this whole thing go easier?
Do you want to start that one, Katie? You want me to jump in?
I don't know.
We both have different aspects of this.
I don't know. Pre-COVID,
I don't know.
I don't know, because I'm like a Scrooge kind of. I just self-describe. So for years I've been like, but holidays really aren't my thing. I have a pretty small family anyways, so I don't know. No. I'm more one to opt out. Thanksgiving this year, I'm going to go to a Red Wings game and stay overnight in Detroit. I'm just not doing Thanksgiving. So I'll let John take this one.
No, that's part of that's a great answer, because ultimately you get to decide. You have the choice to go or not go. You have the choice to participate with what you want to participate in, right? It is not an obligation. It feels like it. And there's often family rules and expectations, historical things that go on that we are aware of, or maybe we're not even aware of why we do what we do. We just do it, right? I mean, there's some simple things you can do. You can mask, you can, gather in large rooms. You can, have cracks in the windows and doors, and not cracks in the windows, crack a window, right? You can do it outdoors, those kinds of things. But the thing, the thing that I always like to come back to with this one is that question of what do you want from your holidays to begin with? What parts work for you, right? What do you actually like? We often find ourselves, I used to teach this holiday stress, surviving the holidays class. And I just mentioned this to Carrie the other day, and she was like, oh my gosh, we have to have you do that.
We need to do this. Yeah.
I may do that soon. It's super fun class, because the beginning of the class is very interactive, and we have people sort of talk about what stresses you out around the holidays, what works and what doesn't. We often know what stresses us out and the parts that we sort of dread. We have some idea of the things that we really love, but we've never really, have you really thought about, if you had 1 to 2 things that you could choose that are the really most important part, do you know what your partner or your spouse's things that they love. You know what your kids actually love, right? I had a woman in one of these classes that I taught who believed that all of the decorations that she started on November 1st, because it took her so long to do, she started doing these things. She thought that her family wanted them, that she was doing it for them. Like, it took her like a whole month and a half to get everything done. It was this huge deal. She would cook all like for a whole week ahead of time. She was exhausted. She was miserable the whole time, but she thought that's what her family wanted. So we had this class, and I said this, I left people with this homework. I said, think about the couple things that you actually want, just the only things that you would keep, if you could keep just 2 things, and then talk to your family about what they would keep. And she came back, she's like, nobody cares about that stuff. I can't believe it. I've been wasting all these months or years and years. It's fascinating, right? We often don't actually spend time encouraging, like listening to each other, wondering about what parts actually matter, right? You get to construct the holiday time based on what actually works for the people who are involved. You don't have to do what you've always done. There's something lovely about tradition, and there can be something very handcuffing about tradition, that we just do things because we've done them, and we assume that everybody wants that, but sometimes they don't, right? And so what, in terms of making it easier, like it's hard, but like what I would say is what I encourage folks to do about all kinds of stuff like this, but to just start from that question. Again, from a position of curiosity, one of my favorite places to hang out, right? What actually works, and what would you get rid of, right? What feels like an obligation, and then talk to everybody about it. See if you can have a really interesting dialogue. Start with your immediate family and what you want that to be, like the people that you're going to be around the most and not necessarily going to a gathering, right? And then you can talk about what the gatherings look like too, and see what happens. You might be surprised. Most people, when they have this conversation, or what I hear back is they report to me that they're often pretty surprised by finding out that people are actually more flexible than they think they're going to be. People get really excited about a couple things, right? But like Katie, like some people just don't get a lot of the holidays, and often that's because it's just a big pain in the butt, right? And it has all this weight to it. Well, what if you started from this question of thinking, I actually want my holiday to feel fun and relaxing. And those are the 2 goals. That's all I want. I don't care how, so then you can construct the holiday events, right, with those 2 feelings in mind. Somebody else might want some, other things, but like, see where you see what kinds of things might help construct that stuff. That kind of changes the game a little bit. So I think that's what I would always say, because it's easy to fall into these just typical practices that we just get used to, and it's hard to break out of them.
Yeah. Well, that's great advice. I appreciate that. And I think that's a really, really good set of thoughts to end things on. As we wrap it up, I do want to give Katie and John just another minute or so. If you have anything else you'd like to share, I do, if you don't mind sharing as you wrap up, Katie, if you want to be protected by a flu shot or by a COVID booster for your holidays, when do you need to get those done? Could you share that real fast as well?
Absolutely. So yeah, as soon as possible. Yeah, like we talked yesterday, right? So 2 weeks. So after like COVID booster or completing an initial series or a flu shot, it really takes about a full 2 weeks for your antibody protection to be fully ramped up. So sooner the better, right?
So literally yesterday
For Thanksgiving, right? If we're speaking to that specifically. So, and then just really, the best tool we have in our tool bags to fight COVID and to fight influenza are vaccines. And, I think that we have almost 2 years of research and data from the COVID vaccine that keeps rolling in. And I think there's a really rigorous process for testing and investigating these. And the safety data is good. And really the benefit outweighs the risk. Ultimately, right? Because we're talking about preventing hospitalizations and death, right? Doesn't mean that you're not going to get COVID or you're not going to get flu. But what, I usually tell people is, at least if you do, you have these antibodies, and that means that it's going to be less severe, a shorter course, less chance of transmitting it to others. So the benefit definitely outweighs the risk. And if you have questions, please ask. There's lots of really great high quality resources, whether it's through the CDC or Michigan Department of Health and Human Services or your own medical provider, right? Like some people may find more comfort in talking directly to that medical provider they have a relationship with.
Right. I'm going to go ahead and launch a poll while John shares any last thoughts he has. We do have just a poll we'd like you to answer, if you can take just a quick second, and then I'll let John share any final thoughts he has before we wrap up.
Yeah, I just got my flu and COVID shot at the same time. Didn't kick my butt. That was great. So just as an FYI, feel very excited about it. Yeah. So the only thing I would just wrap up with is that have the conversation. I mean, it seems simplistic, but have the conversation, right? Like, sit down, be curious, be open, be willing to listen to other people, but know that you can't actually probably solve this without dialogue, right? And that's uncomfortable. And I totally get that. Conversations can be hard. They're weird. It's weird to, put yourself out there with something that might get some heat. But if you don't have the conversation, you don't have enough information, and they don't know enough information about you. And so then we don't have any expectations, right? And so then we're just in that place of not knowing enough, and then we're going to make stuff up, right? Or they're going to make stuff up. Have the conversation ahead of time and think about what it is, where your lines are, where your boundaries are, what's important to you, and what your non-negotiables are. You get to decide. It's your life, it's your family, right? You get to make those decisions, in conjunction with your partner and your family members. So yeah, have the conversation. Take the deep breath and then jump in.
I think that's such great advice for so many things in our life. Sometimes we just need to take that deep breath and jump in. Well, I'd like to thank you both so much for spending some time with us this Friday afternoon. This was such a great conversation and really provided a lot of great tips to think about all sorts of things in our lives, whether it's COVID or just how to navigate the holidays in general. So I very much appreciate your time today. We do offer these webinars monthly. There'll be another webinar coming up in December. If you're not already following us, we have our Michigan Vaccine Project pages on social media that have ongoing regular information about vaccines. And then this is being live streamed to our Michigan Stronger Families page on Facebook. It's My Stronger Family, MI like Michigan. And we provide parenting information and resources and tips for families on that page as well. We always appreciate everybody's time and participation. And again, I just want to thank you very much and look forward to having maybe another conversation with you sometime in the future. This has been great. Thanks.
Thank you.
Happy Thanksgiving.
Thanks, everyone. Happy Thanksgiving.